Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce myself. My name is Rahmayanti Fadillah Asyari with registration number 301022000181. I'm from Faculty of Medicine, Sultan Agung Islamic University, Semarang. And here I will present my assignment article with consort for abstract and full text. Let's go. So for the first 1A. 1A, identification is a randomized trial in the title. The title is Efficacy of Fecal Microbiota Transplantation for Patients with Irritable Bowel Syndrome in a Randomized, Double-Blind, Placebo-Controlled Study. Okay, in the title, we can see that there is a word randomized. So, in this title, we can checklist. Okay, next for 1B. In 1B, abstract. Abstract included like objective, design, result, conclusion, and more details like this. Items to include when reporting a randomized trial in a journal conference abstract. Okay. In abstract, we found this objective. Objective to patient with irritable bowel syndrome and to clarify these contradictory findings. And next, we found this in design, like participant 165 patient. Next, for outcomes, example like the primary outcome, secondary outcome, and next for result, in this result, this here, response under respectively, and conclusion, FMT is an effective treatment for patient with IBS. And next, the last one, trial registration. Example for like this here. But in 1B, cannot be said to be correct because there has not been randomized, blinding or masking, like this, okay? Next, for introduction. Introduction to A. To A example, irritable bowel syndrome IBS is a relatively until findings. Next, for 3A. 3A, 2B not found, and 3A, description of trial design such as parallel factorial including allocation ratio. Okay, in methods, we found this trial design, the patient until was not recorded. And next, for 3B. 3B, important changes to methods after trial commencement such as eligibility criteria with reason. Okay, in 3B, in here, the patient until had ended. And next, for 4A, eligibility criteria for participant. Example, 17 years, 9 until 25 years, inclusion exclusion, age 18 until 85 years, moderate to severe, presence of systemic disease, pregnant, having undergone, and anything. Next, for 5, the intervention for each group with sufficient details to allow replication, including how and when they were actually administered. Okay, this one I found this was administered to the distal duodenum until saline. Next, for measures 6A. 6A completely defined pre-specified primary and secondary outcome measures, including how and when they were assessed. Abdominal symptoms were assessed using the IBS SSS until quality of life. Next, for 6B. 6B, any changes to trial outcomes after the trial commenced with reason, like endpoint, like this. Next, 7A, for analysis. 7A, how sample size was determined. Determine both the bacterial profile and the A. Test uses the vessel until debiosis or until package. Next, statistical analysis for 7B. 7B, when applicable, explanation of any interim analysis and stopping guideline the sample until manuscript. Next, for 15A, for randomization, blinding, and statistical methods not found because in abstract 2 not found anything. Not found randomization, blinding, and statistical method. Okay, and result Result we found is 15A, table 1. Are summarized in table 1. Table 1 is baseline, like this one. Baseline. All patient, example, all patient, age, years, sex female or male. Okay, next for 16, bacterial analysis 16. For each group, number of participant denominator included in each analysis and whether the analysis was by original assigned group. Okay, sum ante respectively in here. Next for adverse event 17A for each primary and secondary outcome like table 5. Next, table 5, this one in here. Adverse event following transplantation. And next for discussion had limitation. 20, trial limitation addressing sources of potential bias implication and irrelevant multiplicity of analysis. So is 20. However, the study also had limitation. It did not investigate the entire intestinal bacteria contents or the long-term effect of FMT acyl groups. Next for funding. Changes. Funding is 25, not 24, and 24 delete. And 23 in here. Trial registration in abstract in here. And so we can conclude that this article not ideal. Sorry if there is a wrong word. Thank you. Bye. Wassalamualaikum warahmatullahi wabarakatuh.